Hi, Dave here with Align Therapy. Today I'm going to show you how I use ASTYM, or tool-assisted soft tissue mobilization, to work into the concavity of a scoliosis curve. Amber's here to help us out, and we're going to show on her how we work on that concavity and loosen up the tissue so that we can get more mobility. Amber has congenital scoliosis, and so there's a lot of tightness that keeps returning because she has a wedge-shaped vertebrae. Well, she has two wedge-shaped vertebrae in her back, and so that tension keeps coming back. So if we can manually loosen that up, then we usually get more opening into the concavity. So Amber, go ahead and lay on your stomach. Usually I'll have the person lay on their stomach with a pillow under their chest or under their stomach, just to bring their back up a little bit. And just to orient ourselves to Amber's back, we have a prominence through here, but her main concavity is right here, right below the left shoulder blade. And right here is where we're going to focus. We're going to try and loosen this up and then manually open this left side. Okay, so what we're going to do here, we are going to use some cocoa butter on her skin so that the tool slides a little bit better on her skin. And the area that we really want to work is right through here. Amber gets really tight right in this area of her back, right by that shoulder blade. So we're going to take some cocoa butter, put that on her skin. Those towels are to make sure we don't get cocoa butter on her clothes. She won't thank me for that. And I do work on both sides a little bit, so I'll put that on both sides. And then bring her up a little bit. And then I'm using ASTYM tools, so ASTYM. These are specific tools for soft tissue mobilization. I'm going to use the middle size with that. There are a lot of other tools out there that aren't ASTYM tools, and you can use those just fine. There's a lot of different tools out there. So ASTYM tools are the ones that I like the most, just because they have a lot of three-dimensional contours, so I can grab onto them easier, have a lot of ergonomic benefit. So I'm going through the paraspinals first, just to loosen some of the muscles up. Amber, you okay there? Am I pushing too hard?
You're good.
So always check in with the person that you're doing this on, because sometimes people are more sensitive than others. I think Amber, I could probably use a jackhammer on and she would still be okay. Is that right?
Yeah.
Yeah.
I like to think a steam roller would feel nice.
A steamroller on her back. We're not going to use a steamroller today. I think that would be a little bit aggressive. So then I'm using different sizes of tools to work deep into those paraspinal muscles. It's kind of a general scraping technique for the back. I use this on a lot of my back patients, just to hit the different areas. Think about where the muscles are and where the spine is. With Amber, we have a curve that goes to the right here. That's why this concavity is there. So just think about what you're feeling with the tool. The tool gives you a good opportunity to feel what's tight and the texture of the tissue, which tells you the kind of the health of the tissue, how much collagen is disorganized, and on the back usually it's pretty smooth, but if you're doing this on tendons or you get down to some of the attachments in the pelvis, then it can be a little more textury. So we go on the paraspinals. I'm going on the thoracolumbar fascia that comes out, where kind of like a big diamond in the low back where all the muscles attach into. So trying to hit all of that thoracolumbar fascia. And then we're going to get specific to where her concavity is. This is the area right here that tends to get really tight on Amber. So I'm going to do a little more work up through the lats, through the lower trapezius as that comes down, And I'm even going to get a little bit deeper and try and get into the quadratus lumborum. That's deep down there. I think Amber told me that the quadratus lumborum was a made-up word. Is that right?
Yeah.
So I don't think it's a made-up word. I hope it's not, because I learned it in school. So we're trying to get deeper through there. If you go out too far, then we kind of just get into the tissues on the side of the abdomen, and that's not really as much muscle tissue, so I'm trying to stay a little bit closer to the spine. And in that concave side, you can feel the tightness, kind of like ropey bands right there. That's where you get some of your pain, right, Amber? Right there. So right here, like in the longissimus thoracis, that's not a made-up word either, Amber.
Sounds fake.
It sounds fake. But really, you're trying to feel for any of those muscles that are tight. They might feel tight on both sides, but these are the ones that kind of lock her down because of that concave side of her scoliosis. So I'll work deep into those with the tool, and then what I like to do after I work with the tool is I like to just get my fingers in there and just loosen that up as much as we can, specifically right on that paraspinal. So we're trying to get more mobility through there. So I can get a little more specific with my fingers because I can feel where that tightness is. The tools can give you a lot of feedback on what you're feeling in the tissue, but there's no substitute for your hands where you can feel what's going on in the tissue. So then I'll go a little deeper. The quadratus lumborum is a little bit more lateral, and so I'll dive kind of into that. That comes up and attaches into the ribs. So when you hit the bottom ribs, that's where that attachment is. Amber doesn't have a ton of space between her pelvis and her ribs, about that much space. And that's part of the problem, is we have that collapse into the concavity that brings the ribs closer to her pelvis. So I'm just trying to get more space. So then I'll do a little bit of stretching here, trying to open that concave side. Does that feel okay, Amber?
Yeah.
You feel it stretch with that?
Yeah.
So we're trying to get some mobility and really just stretch out what we just worked on with the tools and with my hands. So sometimes I'll have them go on their side and we'll stretch it out like that. Sometimes I'll do some manual work while they're doing a semi-hang exercise in the Schroth method. And depending on how long they can hold that, it might be a little bit hard to do for very long, but then we can work on getting some expansion with breathing too. I don't do that with a ton of patients, but with some we'll do that. Manually stretch out the concavity. And we also want to give a little bit of attention to the right side, because the right side is also tight, just not as tight as the concave side usually. I would say most people with scoliosis that have back pain related to that, it's on the convex side of the curve, on that prominence. But with Amber, it's more compression through where the concavity is. So a little bit different, but not every scoliosis patient is the same. So keep that in mind as well. Okay, so we've worked on increasing mobility of the concavity on Amber's back. She's feeling a little bit better, so now we're going to go stretch and see if we can increase that concavity mobility even more. So thanks for watching.